we already did a suctioning, so now we're gonna do the trach care. So we're gonna clean the trach and the tracheostomy, and we're gonna remove the dirty gauze. So what I want to do is I already lowered it because after the suctioning I wanted to I did check his O2. But right now we're gonna hyperoxygenate because we're gonna be taking out the cannula, so we want to hyperoxygenate again once more. But we had already done an assessment after we did the suctioning. So right now I'm just making sure I have my supplies, and I have a trach kit, and it contains everything we're gonna need: the gauze, the string to tie the reinforcement string here, and then it has gauze. It has the little scrubs that we're gonna use to clean the cannula. So the easiest way to remember this procedure is how Professor Ramirez showed us that there's a clean technique, sterile, and then again clean. So the clean part is just setting up. So I have my supplies: hydrogen peroxide, normal saline. I have an extra pair of sterile gloves that are my size. I have gauze that we're gonna use to do wontons to clean the trach. I have a towel in case we needed to put it over him, in case any of the secretions fall onto his chest. And yeah, so the trach kit has everything we need, and the clean part is just setting everything up. First, I would have to, since it's a continuation, I would have already been in the room, but if it was just care, knock on the door, make sure you have your supplies, identify the patient, explain to the patient what you're going to be doing. We're gonna get started. Mr. Williams, we're gonna do trach care. I know you feel much better after the suctioning. So I'm gonna put some clean gloves on. I'm gonna start hyperoxygenating already. And I had already performed hand hygiene. I'm gonna provide for privacy, close the window, close the curtain to provide for privacy. I'm going to hyperoxygenate for a blow-by. So that just means like putting the oxygen all the way to the highest level. And we have this here, but I'm gonna just loosen it a little bit so it can just blow by, and I have more area to work on. And for better positioning, I'm gonna lift up the bed. Also, I'll adjust the degree of the bed, the head of the bed. So I'm just gonna bring it a little closer so I can have more access to his trach. I would ask him if it's okay if I take out the pillow. As you can see, you have better access without the pillow. I would put it somewhere else. So I would raise the bed just to a comfortable height. Make sure the table's okay. Okay, so it's on blow by, and I'm just gonna adjust it.
Oh, no.
Okay, so the first part is the clean technique, and we're gonna set up our station. So we want to keep a certain area sterile, and I'll make it this area since it's closest to the patient and closest to the trach. So I'm gonna open up my supplies, the bottles I'm gonna use to fill the areas, and I'll show you now. This comes with a drape, so we're gonna make our field, and I'm gonna open this away from me, just in case. Like, I don't want to get it dirty. Okay, so as you can see, there's an extra set of gloves, but I already have a pair that I'm gonna use. These aren't the best size for me, but I'm gonna take them out, and I can touch this. I'm not gonna use these. I'm gonna put them on the side. Here's the drape. You're gonna make sure your table's clean. Here's the drape. I'm gonna touch the outside of it, so you can touch the corner, and I'm gonna set up the station here.
Yeah, this is after that.
Okay, so check your energy.
And you want to put the shiny part down, which is this part, and you put it like this. You never want to cross your hands or your arms over your sterile station. Okay, so you can dump these contents into there.
It's too much. Yeah,
And this is still sterile.
too much.
Okay, and these are my gauze that I'm gonna use to clean his trach, and these are gonna be made into wontons. We're gonna put normal saline on them, so I'm gonna empty those in there too. These come in sterile packaging, so I'll put them on my sterile field.
I guess that was like the IV site.
That's what she forgot. That's what we need to do. That's what you have to do.
And then I would have a trash can, and I could just
Before you do your secondary.
put these in the trash.
You got it.
Okay, so now you have to fill your contacts. The smallest one is gonna have the hydrogen peroxide, because hydrogen peroxide is an antiseptic and it's really strong. So we're gonna have that here, normal saline and normal saline. So it's like washing dishes, like soap, water, and water. So first, I'll grab the bottles. You don't want to cross over your sterile field, so just like reaching over. So like you have to make sure if it's been opened before. If it's not, you time and date it. But this one's new, so I'll just I would date it and put my initials on it. So you can just put a little bit here.
That's it.
Okay.
You're not gonna
Breathe.
And next is the normal saline. This one's been opened, and I noticed that it's still okay, but I do have to clean the lid. So I'll take off the lid, and I'll drop some a little bit into the trash can. I'll put this here, and then I can pour some here, and go around the over here and put some normal saline here.
location, O part.
Okay, so I have pretty much everything set up. I'm saving my sterile gloves for when I start the sterile part of the procedure. So the clean part of the procedure ends when I take this off of the inner cannula off of the patient. So I'm gonna do that now. He has already been hyperoxygenated, so I'm gonna let him know, okay, Mr. Williams, I think I said, I'm gonna take off the inner cannula now, okay? I'm gonna lower this, have better access. Okay, here you go. Are you feeling okay? Okay, it's not gonna hurt, okay? It'll be a little bit uncomfortable. So I hold my fingers against the plate, and it's just a clasp, so it has wings, and I just take it off. 9 to 6. That's how we insert it, and that's how we take it out. So this is gonna be placed in the hydrogen peroxide, and that's where the clean procedure ends. And to clean that, we're gonna use sterile procedure. So we take off our clean gloves. And I'm gonna open the sterile gloves now. And I'll be able to access my sterile field once I have my sterile gloves. Sorry. Okay, so these are opened like this. Okay, now the inside will be sterile. So I can only touch the outer part of it. I try to fold them out like this so the edges don't fold in on me. And now I could touch this part of the glove, and then I'll try to put it on without touching the fingers that you see there. So this one's this hand. So I just slip my hand in here. Okay. Okay. I'm gonna touch the inner part of the glove. So as you can see, I'm touching the inside of here. Okay. So I'm gonna place my hand in here. Okay. Now I'm still touching only the inside. Putting over my watch. Okay. There we go. Now I can adjust from the inside my glove. So, there we go. Now I can throw this away. I don't need it. Now I can access everything that's sterile. So I'm going to organize my supplies. Okay, I have the gauze that I mentioned. I have this wire brush. So it'll be to clean the inside. Cotton tip applicators I'll use with a little bit of hydrogen peroxide to clean around the area. These will be to insert into the cannula to rinse it out with the normal saline. This is the string that I mentioned to tie the trach to. More cotton tip applicators. And then finally, we have a little bit more gauze, and then the slit gauze. which we're gonna replace with the one he has. Okay, so I'm ready to do the sterile part of this. So it'll be I can bring my tray closer to me.
Are we gonna blow it too or not?
Just that.
Okay, so I have my wire brush, and now this will be my sterile hand. I'll touch the dirty part of the inner cannula, and the sterile is the wire brush. So I'm gonna dip it a little bit in hydrogen peroxide, and I'm inserting it into the inner cannula, and I'm just cleaning it. It's already been soaking a little bit in the hydrogen peroxide, so I'm just cleaning the inside of it. Just like 2 or 3 times is okay. And then you drip. Okay. And then you put in the normal saline. Okay. And then I would get one of these. I forgot the name of them. But yeah, and you could use them to rinse the inner cannula.
It says saline flushes.
Okay, and the last is here, the second normal saline.
It says volume and pump.
Okay, and that's it. It's clean. I'll just make sure there's no normal saline. It's okay if there's a little bit. And I'm gonna insert it in a 9 to 6 fashion. So start downward, and then I'm gonna, 6 to 9. So start 6 and then tilt it downward like this. So I'm gonna do this. It doesn't matter sterility because this is the end of the sterile part of the procedure. So I'm putting it in the 6 to 9.
Your turn. Your turn.
I'm having some difficulty here, but we'll get it. Okay, so it's in, and then we just clasp it to the tray. Okay, so we're done, and then we just let him oxygenate a little more. Okay, I'm done with the cleaning the cannula. Now I'm gonna clean the outside of it. Okay, so it's okay. I don't need to be sterile anymore. But yeah, so now it's clean. I could either change my gloves or keep the sterile gloves, which I would keep the sterile gloves. They're still fairly clean. And yeah, so now we want to clean the outside part of it. We still have his towel here, and that consists of the top, the bottom, the sides, and the lace. I could use a little bit of hydrogen peroxide, so I'll maybe use like 2 of these to clean the edges. Where there's like a lot of secretions, I would use the hydrogen peroxide. So here I would clean the sides. And whenever you use hydrogen peroxide, you just have to make sure to, and then I would throw this away. You just have to make sure to clean it with normal saline after. And just one for the top. Okay, and I could just normal saline. Okay, now I'm gonna remove the pad because I want to clean underneath with the wontons. So I'm gonna put this a little more to the side. I'm gonna take off the pad underneath. Okay. So it's dirty, so we want to throw it away. And we're not gonna put the new one yet. We still want to clean. So we're gonna make wontons. And I don't want to touch the bottom part of this, but I can make a wonton with the top part. So like this. It's a little wonton. Like this. And then you press it in a little normal saline, and you clean it underneath of it. So we throw that away, and you do another wonton, and you can do as many as you need to get that to be cleaned. So a little bit of normal saline again. If it's really dirty, you can use the hydrogen peroxide, but make sure that you rinse with normal saline. So we got that to be clean, and we could change the lace now, or we can put the pad first. I think I'll put the pad first. So I've already cleaned the area, and I'm just gonna insert this underneath of it. So here, I'm sorry, I'm gonna go over your head here. I need to put this underneath. Okay, and then I would change the lace. Make sure there's no knots on it. Okay, it's tied on this way, but I don't want to tie the old one until I tie the new one. So I'm gonna make sure I have this here. Some people use pliers or something to get more exact, but I think I can do it fairly well without any of those things. Okay, so we go on the other side. I'm sorry, I need to go around your head here. Okay, just make sure it's not twisted. And then you're gonna come back this way, so give him some room here. And a lot of new hospitals have like Velcro, so it's not really a problem. But this one doesn't, so I'm sorry, I just need to get over here and then just make sure there's no knots. And then you could do what's called a square knot. Okay, and you're free to untie the other one. And you just get rid of the other one. Make sure there's like 1 finger room of space. You don't want it to be too tight. So this is the old one. And there we go. And that's it. And you just put everything away and you're done with your Trach Care.